All right, so this is a talk. It's a nuclear medicine talk on mystery whole body scans. It's a very important practical skill, just in case the tech brings you a study and doesn't label it or tell you what it's for, and then quits, and then gets rid of the acquisition and the patient's medical record number. And you still have to dictate the study. It's nice to be able to figure out what kind of study it is for that very practical situation. Makes a lot of sense on why this would keep showing up on boards, both oral boards, written boards, forever boards. Okay, so this is the algorithm that I endorse. There's a bunch of different ones. I think I list 3 different ways to do this in my book. But this is the one that I feel, this is my go-to. So the first branching point is to decide whether or not you can see the bones. So you can either see them or you don't. So that's the first thing that you look for. So let's go down this path where we do see the bones. The next thing you want to look at is a spleen. So you basically have 3 scenarios. You've got a spleen and no liver. You've got a liver and spleen that are equal, and then you've got liver and no spleen. So either yes, tied, or no. So if you've got a spleen, this is a white blood cell scan, and the way I remember that is, you've got red pulp and you've got white pulp in your spleen, so this is a white pulp thing, and sulfur colloids like reticular endothelial system thing, and it's there's a liver spleen scan that's a sulfur colloid scan, so that's the way that I remember that. And then the last one is gallium, and gallium is an iron analog, right, which is an acute phase reactant, and I remember that lactoferrin is made in the liver, so it makes sense that it would be there and it would be hot. Gallium, of course, also has some salivary gland uptake, and that's helpful too if you can't, some people use the salivary gland presence or absence as an algorithm as well. All right, so there's our spleen. Okay, so now let's go down the scenario where you don't have bones. So we'll look at some of those cases. So your first thing you got to decide is whether or not the patient has a heart. So there's going to be 2 situations where the patient has a heart. There's going to be 2 situations where you don't. So keeping them straight here. So this is the way that I do it. I remember that, MIB-Y's easy because Sesta-MIB-Y is like the main cardiac agent. If you've done any cardiac nukes at all, you can remember Sesta-MIB-Y is MIB-Y, so it has to have a heart. MIBG, the way that I think about it is, if you don't care about kids with neuroblastoma, then you just don't have a heart. Now, the way that you separate them out is whether or not they have kidneys or not. And MIBG will not have kidneys. So how do I remember that? I remember that, MIBG is for neuroblastoma imaging usually, and neuroblastoma is usually in the adrenal gland. So if you had hot kidneys, if that was like a normal thing that was part of the scan, it'd be pretty hard sometimes to be like, is that the kidney or is that the adrenal or whatever? So it not being there is very helpful so that you can interpret the exam. So there's no kidneys on an MIBG. And then the other one is the other one. All right, so what do you do when you have a situation here where you don't have a heart? That's the other branch point, right? So what you've got to decide is whether or not you have a liver or not. And I'll back up just for a second and say that I may have confused you when I said that the way that I remember the MIBG thing is if you don't like kids with neuroblastoma or don't feel sorry for kids with neuroblastoma, then you don't have a heart. Well, some of us went into radiology because we don't give a shit about patients, right? So the way that I actually remember this is by saying, sometimes you have a heart, sometimes you don't have a heart. Not everybody's got a heart when it comes to neuroblastoma patients. So the cardiac thing is variable. But even if you don't have a heart, you always have a liver. So that's MIBG. Now the alternative is iodine, which doesn't have a liver, usually. Now there is a trick, which is in a post-iodine 131 ablation situation where you don't have, you're getting treated, you can have liver uptake, and I'll show you a case of that. So then you may say, well, if you've got liver uptake, then how the hell do you distinguish between these two? You look at the bowel. And the way that I remember that is, if you're trying to trick me with this iodine thing, then you must be full of shit. So this one's full of shit, this one's not. Bowel uptake is a difference. So here's an iodine study, and you can see sort of some faint bowel uptake. A little bit right here too. A little bit of residual thyroid. So this is an iodine post-thyroid therapy. All right. Okay, so we got a guy who has no bones, no heart. He's got a little bit of liver activity, but the spleen is much hotter. And then we notice that the kidneys are really bright, really stand out. So when you see that with the kidneys like that, I want you to think of octreotide. Octreotide. Okay. Now, let's just run these and compare these real quick, and I'm going to offer a strategy. So remember, the situation here is no bones and no heart. Let's take a close-up look. So we've got a guy who has a liver greater than a spleen greater than a liver, and no liver and no spleen. So remember, if you don't have a heart, he does have a liver. So this is MIBG. This person here, I'm really noticing those kidneys standing out. So this octreotide. And then neither is going to be iodine, right? Except for one special situation, that's post-treatment. All right. So let's do a couple of special situations here. We'll walk through this. So what's the first question we ask? Bones or no bones, right? So these guys have bones. Agreed. Now we're going to look at the spleen. So what do we think of that spleen? I think it's a really hot spleen. I think it's too hot to be anything else. It's certainly not gallium, which doesn't have a spleen. And for it to be sulfur colloid, you'd have to have a really abnormal liver to be having that colloid shift. It looks like there's still some in the liver, so the spleen looks hotter than the liver, or too hot to be anything else other than a white blood cell scan. And strangely, I would say that that's probably the case for both of them, right? Right? So what's different about these two? This one has some bowel uptake, and this one doesn't. So they're both making the algorithm for a white blood cell scan, but one has bowel uptake and one doesn't. So the difference is indium versus TEC. And I'll point out also that TEC has maybe slightly higher counts relative to indium. That might be a way that you can use to tell them apart also. So let's look at another special situation. Similar sort of algorithm here. Okay, bones or no bones? Bones, right? Okay, so now let's look at the spleen. Again, that spleen is way too hot to be anything other than a white blood cell scan. So pretty much have to go there, right? So what's the difference now? Alright, well this guy has bowel uptake and this one doesn't. It's the same case as last time. Similar, but something else is different too. There, the lungs. Notice that? This guy has lung uptake. This one doesn't, but no bowel. Alright, so what's the difference here? So it's a trick. They're both TEC scans, but this one's done early. So early on, if you image TEC like around 4 or 5 hours, the lungs will be hot like this, but there'll be nothing in the bowel. Whereas if you image late, like after 24 hours, the lungs are clear, but then you start having it in the bowel. So it all depends. You could imagine that you could manipulate this kind of thing to say, well, if you wanted to look at the bowel and you only had TEC tracer, this would be the time to do, or like a pelvic abscess or something like that. That you would want to image before 24 hours, right? Because otherwise you get bowel uptake. Probably the same thing, but pulmonary stuff you would want to wait till later. All right, next situation. Got 3 different bone scans. Look similar, but they're not. Let's sort of point out the differences. So this looks like a regular bone scan, right? This is the ones that we're used to seeing. There's no brain uptake, and it's relatively low count compared to this. It just doesn't look, this right here sort of looks like a MIPT PET almost, like the spinning dude on the PET. But it's not a PET, right? Because PET has to have brain uptake. So what is that guy? Take a closer look. So this we decided was a regular TEC MDP. So this is a different kind of PET. It's a fluoride PET, F18 PET. It's another kind of PET that you can do just to look at the bones. So what about this last guy? We noticed the brain uptake, so we're thinking it's a PET, but it looks weird, right? It's too much bone uptake. It doesn't usually look like that. So this is a marrow stimulation, right? So, when you see diffuse marrow uptake like that, it's a marrow stimulation thing. So similar, but not the same. All right, next case. Let's run through the algorithm here. Bones, no bones. Heart, no heart. Liver, no liver. Does have one of these. Bones, no bones. Heart, no heart. Liver, no liver. Iodine. Right? All right, next case. Bones, yes or no? I would say yes, right? What about the spleen? Doesn't have one, right? What about the liver? Well, just not having a spleen itself does everything you need to do, right? So we got this answered. It does have salivary gland uptake, so that's gallium. Boom. All right, now, next one. Bones or no bones? No bones. Does he have a heart? No, no heart. What about a spleen? Yeah, he's got a spleen. But I'm also noticing it's really an intense spleen, and his kidneys are super duper duper hot. It's an octreotide scan, right? Really high counts, spleen, kidneys. All right, what about this guy? Bones or no bones? Yeah, he's got bones. Spleen or no spleen? Definitely has a spleen, right? Looks hot. It's hot. It's a hot spleen. Liver? It's got a liver, but not as hot as a spleen. Does he have bowel uptake? No. So this is the indium white blood cell, right? If he had bowel, then you'd think TEC. All right, next case. Bones or no bones? No bones. Heart? Yes. In this case, you do have a heart. Kidneys? No kidneys, they would get in the way. of my MIBG diagnosis. All right. And now there's this one, brain, right? So anytime you see that, take an FDG. All right, so that's the end of this talk. And next one will be dedicated bone scan imaging, nuclear medicine.